Introduction to First Aid in Burns. Burns are injuries to the skin caused by heat, chemicals, electricity, or radiation. First aid for burns is crucial to minimize damage and prevent complications. Understanding the basics of burn care can help you act quickly and effectively in an emergency situation. This guide covers essential steps in providing first aid for different types of burns. Types of burns. Burns are classified into three main types based on their severity. First-degree burns affect only the outer layer of the skin, causing redness and pain. Second-degree burns affect both the outer and underlying layers of the skin, resulting in blisters and swelling. Third-degree burns extend through all layers of the skin, potentially affecting muscles and bones, and require immediate medical attention. Understanding these types helps in providing appropriate first aid. Immediate first aid for burns. The first step in burn care is to stop the burning process by removing the person from the source of the burn. Cool the burn with cool, not cold, running water for at least 10 minutes. This helps to reduce pain, swelling, and tissue damage. Remove any tight clothing or jewelry near the burn area, but do not try to remove anything stuck to the burn. Treating first-degree burns. First-degree burns can usually be treated at home. After cooling the burn, apply a moisturizer or aloe vera gel to keep the skin moist. Cover the burn with a sterile, non-stick bandage to protect it from infection. Over-the-counter pain relievers like ibuprofen or acetaminophen can help manage pain. Monitor the burn for signs of infection, such as increased redness or swelling. Treating second-degree burns. Second-degree burns may require more intensive care. Cool the burn with water and then cover it with a clean, dry cloth or non-stick bandage. Do not pop blisters, as this can lead to infection. Seek medical attention if the burn covers a large area, is on the face, hands, feet, or genitals, or if you notice signs of infection. Follow your healthcare provider's advice for further treatment. Treating third-degree burns. Third-degree burns are a medical emergency. Do not attempt to treat them at home. Call emergency services immediately. While waiting for medical help, ensure the person is safe from further harm and keep them warm. Do not apply water or ice to the burn, and avoid removing clothing stuck to the burn. Cover the burn with a sterile, non-stick bandage or clean cloth. Chemical burns. Chemical burns require immediate and specific first aid. Remove contaminated clothing and rinse the affected area with cool running water for at least 20 minutes. Avoid using strong streams of water, which can cause chemicals to spread. If the burn is caused by dry chemicals, brush off any excess before rinsing. Seek medical attention immediately, even if the burn seems minor. Electrical burns. Electrical burns can cause severe internal damage, even if the skin damage appears minor. Turn off the power source before approaching the injured person. Call emergency services immediately. Check for signs of breathing and a pulse, and begin CPR if necessary. Do not apply ice, ointments, or any household remedies to electrical burns. Cover the burn with a sterile, non-stick bandage. Inhalation injuries and burns. Inhalation injuries can occur in fires, especially in enclosed spaces. Symptoms include difficulty breathing, coughing, and soot around the nose or mouth. Move the person to fresh air immediately and call emergency services. Monitor their breathing and be prepared to perform CPR if necessary. Inhalation injuries require immediate medical attention, even if there are no visible burns. Conclusion and prevention. Proper first aid for burns can significantly improve outcomes and reduce complications. Always seek medical advice for severe burns or if you are unsure about the severity. To prevent burns, practice fire safety at home and work, handle chemicals carefully, and use protective gear when necessary. Educating yourself and others about first aid for burns can save lives and minimize injuries.